Since early March, Wake County, just like the rest of the nation and the world, has been working to slow the spread of COVID-19 in our community and protect the health of our residents.
That's right, Chair Ford. And today we want to jump right into the public health team and what they've done in response to the virus and explore the next steps to help us reopen safely. Joining us today, we have our Wake County Human Services Director, Director Regina Petteway, and our Wake County EMS Director, Dr. Jose Cabanas. Welcome.
Thank you both, Dr. Cabanas and Director Petteway, for the great leadership you provided. Both Dr. Cabanas and Regina have been on the forefront of our response efforts since the first positive case was identified on March the 3rd. Thank you again for your great job.
Thank you for having us.
Thank you for having me here.
Director Petteway, why don't you walk us through the early days of COVID-19 and tell us how we got to where we are today?
Thank you, Chairman Ford. As you mentioned, we've been responding to COVID-19 since March the 3rd. County identified the first positive case in our county. On March the 5th, in conjunction with the Emergency Management Center, we began to coordinate county-wide response with municipal and county partners and with our state colleagues. We focused our efforts on three things. One was containing the spread of the virus through proactive prevention efforts, investigating the way residents may have been exposed to infected individuals, and sharing the latest, most accurate and relevant information with the public. So over the past 3 months, we've adapted our response efforts as the situation changed and as the virus became more widespread. On March the 24th, we added a mitigation strategy to the fight of the virus. And that mitigation strategy included focusing on decreasing the spread among individuals who were at highest risk of serious illness. It also included monitoring the at-risk we tested, but no longer monitoring all the cases in the public at large. So now that we're slowly working towards reopening the county, we're transitioning back to our original containment strategy, and that includes mass testing, contact tracing, investigating potential exposures, and monitoring those at a higher risk. And this will help us contain the virus as much as we can as we begin to resume some of our normal activities.
You mentioned this contact tracing. For those who don't really know exactly what that is, can you take a minute and explain what that is and then why that's important?
Sure. Contact tracing is essentially disease detective work. The use of contact tracing is one of the oldest public health tactics that we have available in our toolbox. It allows us pretty much to trace who may have been exposed to COVID-19. This method is one of the best tools we have to avoid future outbreaks and further spread the disease. Essentially, when we identify a person who may have the virus or has presumptively tested positive for COVID-19, we immediately ask the person to self-isolate so they don't spread the virus further. Then we ask the person who they have in contact with, and we create a list of the people that they potentially have been exposed to the virus. And next, we determine the people's level of risk, and if needed, ask them to self-monitor and quarantine themselves for 14 days. This process repeats itself as many times as needed to contain the exposure and sort of mitigate any additional spread of disease. It is important to understand that we cannot do this work by ourselves. We need the community's involvement and participation when we're trying to conduct these activities to mitigate the rapid expansion, the spread of COVID-19.
Contact tracing is a part of mass testing, which is now in effect. Regina, how is drive-thru testing going?
Thank you so much for asking. It's going very well. And that's important because the results of the hundreds of tests we're offering every day help us do two things. One is to understand how the virus is spreading in our community, and also to make informed decisions about reopening the county. On June 1st, we started offering drive-thru testing, free testing, at locations around the county. We've had successful testing events in Raleigh, Fuquay-Varina, and Wendell, and we plan to hold more in municipalities across the county. So far, we've tested 2,000 people, and about 100 of them were positive for COVID-19. In addition to our drive-thru testing, we're working with the state to promote testing available through doctors' offices, urgent care facilities, and pharmacies. And we've compiled these resources online at wakegov.com/testing. So by testing more widely in the community, Dr. West, we can identify people who have contracted the virus and help prevent them from spreading it to others.
Thank you, Director Petteway. That explanation is very helpful. So is this testing open to anyone?
Right now, the drive-thru testing is reserved for those who have COVID-like symptoms, including fever, coughing, shortness of breath, nausea, and loss of smell. For those who have close contact with a known positive case of COVID-19, for those who are healthcare workers or first responders, for people working in high-risk settings like long-term care facilities, correctional facilities, or homeless shelters. It's also available at no charge for people who are over 65 years of age, have underlying health conditions, or people who are a member of a vulnerable or historically marginalized population. If you're a frontline worker in a setting where social distancing is difficult, or if you've participated in protests or mass gatherings, if you meet any of these criteria, you can be tested. Our goal is to test 3 to 5% of the county, and we're using criteria implemented by the state to determine who gets tested. And if someone doesn't fit into one of these many categories, they may still be able to get a test through a pharmacy or medical provider.
So Dr. Cabanas, for those who might want to sign up for the test, what do they have to do to sign up for drive-thru testing? And then once they get there, what should they be expecting?
Thank you for that question. So obviously, if you're one of the groups that we're targeting for drive-thru testing, as Director Petteway sort of explained, you should visit our website, wakegov.com/testing, to identify everything and find everything you need to know as you go through this process. We're asking people to register and provide their contact information so that we can notify them if they test positive for COVID-19. To streamline the flow of traffic, we also need people to commit at least around half an hour time window when they will come up to the test site. When it's time to get tested, it is important to understand that residents and people that will come to the test site should bring a printed copy of the registration form, along with an ID, such as a driver's license, voter registration card, passport, or a utility bill. Residents should stay in their cars and follow the directions given by staff. A Wake County staff member will hand each participant a self-administered COVID-19 test, and they'll use it to swab the inside of their nostrils. They'll place the swab in a test tube, put the test tube in a bag, and hand it back to the Wake County staff member on the site. This system actually ensures there's virtually no contact between the test taker and the test provider. I'm also happy to say that the tests we're using are easy and painless. All of us have heard the challenging stories about the early coronavirus test, which took samples deep into the nasopharynx, which were created some discomfort to the patients. These tests we're using require just a quick swab in the anterior part of the tip of the nostrils.
Thank you, Dr. Cabanas. I really appreciate how organized and thorough this process is for testing. So once tested, how long does it take to get the results?
Yes. So LabCorp will process their tests approximately within 48 to 72 hours. Anyone who tests positive for COVID-19 will get a phone call from our public health team working in the Emergency Operations Center. Those who test negative will not be notified. Even before you get your results, if you have COVID-19 symptoms, it's important to understand, or if you came in close contact with someone who tested positive, that you should return home after the test and self-isolate until you receive your results. If you do test positive, you should remain in self-isolation and follow the instructions provided when you are notified of your positive test result.
Offering testing within our vulnerable population is something that is important to our board. I remember at our last meeting, we talked a little bit about some of the areas that had demographics that were high as it relates to the COVID-19 and issues around demographics. I think 27610 may have been one of those and several other clusters. So, Director Petteway, how can we share this testing and how it should help our communities, even in terms of follow-up for the future?
So, Dr. West, you know that through mass testing, we can identify where there are pockets of this virus in our county. And if we see that there's a large number of infections in one community or geographic area, then we know that's where we need to focus our efforts and offer more resources. So you also know that health conditions only tell a part of the story. The risk of contracting COVID-19 increases if you don't have stable living conditions or access to health care, and there are things that put you at higher risk for this. And these are things that don't have to do with how your body is configured or what your genetics are. They have to do with where you live and what you have access to. Our public health team closely monitors these factors as well as information and demographics collected from positive cases to help direct our responses. One trend that we have been seeing in the disproportionate rate is a trend of Hispanic residents testing positive for COVID-19 compared to the rest of the population. This is something that we focused on in addition to a similar trend in African Americans, and we're looking at both of those and how we mitigate those in the upcoming weeks.
And we know this is not unique to just Wake County. It's a trend that's happening across the entire country. So Dr. Cabanas, can you share with us a little bit of that data?
Commissioner, that is correct. We are seeing similar disproportionate numbers here in Wake County. Just to give some context, as we all know, around 10%, 10.4% of our population in Wake County are Hispanic or Latino. But nearly 40% of all cases, COVID-19 cases, where we have reported data on race and ethnicity are Hispanic. It is important to know that none of our positive cases report race or ethnicity. This is why it's critical for us to collect more of this information to better understand sort of the burden of disease in the community among minorities population. But from those that do, we can see preliminary data that suggests a disproportionate burden of illness and death among racial and ethnic minority groups in the community.
Dr. Cabanas, what factors do you think contribute to these numbers based on just listening to some of the things that have been going on? It appears that there are multiple factors and that those that may be in low-income communities, there are already factors that and conditions that compound the situation.
Yes, sir. We all know that COVID-19 has magnified some known disparities in healthcare that we all know exist among minorities in our community. But in essence, there are three main factors that could contribute to these numbers or this data that we're seeing. Number one is living conditions. work circumstances, and underlying health conditions or access to healthcare. We all know that one of the beautiful things about, for example, the Latino culture is the family cohesiveness. Many times you have grandparents, parents, and children living under one roof. But being in close proximity to each one another means it's easier to spread COVID-19 from person to person. Also, we all know that many Latinos and Hispanics work in essential jobs that make teleworking or social distancing impossible, putting them at high risk for contracting the virus. Also, underlying health issues and barriers to getting access to healthcare, primary healthcare, makes members of many racial and ethnic minority groups more vulnerable in public health emergencies like the outbreak of COVID-19. Another example is not having health insurance. It's a real issue for many in the Latino community. They are 3 times more likely to be uninsured than white Americans. So we all know this disparities in healthcare have been exacerbated or magnified by the pandemic. All this combined puts Latinos at greater risk than many other across the community.
Thank you.
Thank you, Dr. Cabanas. And as you and Director Petteway have both mentioned, COVID-19 has had a disproportionate impact on certain populations. So what are we doing in Wake County to help the Hispanic and Latino communities specifically to ensure that they have the resources they need?
Yes, Chairman Ford. So I can attest, and Director Petteway can attest as well, that, and obviously Wake County it's all hands on deck. This is a community-wide response, and every resource available in Wake County is being there to work in this emergency. Wake County is working very closely with community partners to help reach populations who may be at higher risk. We're being very intentional about connecting with employers to encourage the use of masks, face coverings, and implementing very strict cleaning protocols and following those public health guidelines, including social distancing. For example, if you own a business or provide a service where staying 6 feet apart is impossible, then we really encourage you to ensure masks and PPE are available for your employees and have adequate stock of hand sanitizer available at your work site. We've also been very intentional about making sure that we are communicating proactively with our community. Wake County's COVID-19 webpage is translated into English and the top 10 languages spoken in our community. This helps non-English speakers better understand what the risks and symptoms of COVID-19 are and what actions they should be taking. We've also created a toolkit full of health and safety information about COVID-19 and share it with more than 100 local multicultural organizations. The toolkit makes it easy to share accurate, up-to-date information in their native languages with their members. But we're not done. We're just getting started. And we continue to work together to make sure that we have a multi-pronged approach to this emergency. And as we keep putting out more interventions, we'll be definitely communicating those to our community.
Cabanas. We also know that our nursing home and our long-term care facilities house another high-risk population, our elderly citizens, and many of them we know have underlying health concerns. So, Director Petteway, what's the public health team doing to work with these facilities to make sure that we prevent the spread of the virus?
Commissioner Hutchinson, you are correct. Nursing homes do have residents who are at significant risk of serious health concerns, including death, if they contract COVID-19. And that's why, as some restrictions in the state have been lifted, the ones that are surrounding or that have to do with nursing homes and those types of facilities have pretty much stayed in place. So in addition to restricting visitors, nursing homes are strongly encouraged to have their staff wear the appropriate protective equipment at all times, to restrict employees from working at other locations, to practice social distancing when possible, and to frequently clean surfaces with disinfectant. Now, also, we do extensive testing at those facilities and testing of the residents and staff where positive cases have been found. And we do that in order to control the spread of the virus and to protect the health of everyone there.
Director Petteway, what can we all do together as we work together to reopen in a safe and healthy manner?
So Commissioner West, I'm sure you know that we haven't reached the peak yet in the number of cases with this virus, and it is still a major problem in our community. But as the county begins to reopen, it is more important than ever to practice strict social distancing. Stay 6 feet or more apart. Also to wear a mask or face covering and to wash your hands well. The threat of COVID-19, again, is not over, and we all have to continue to work together to keep our community safe. I know people are getting tired of hearing us ask them to stay at home and stay 6 feet apart, but I just want you to remember that when you do these things, you are protecting yourself, and just as importantly, you are protecting other people from possible hospitalization or death. Now, you know, the state has also issued, again, some guidelines to remember what to do when you leave your home, and they call them the 3 Ws. So according to Dr. Cohen and our state partners, they want you to wear a cloth face mask, wait 6 feet apart, and wash your hands frequently or use hand sanitizer. And these actions can help protect us as we take a cautious step forward to ease restrictions while the virus is still circulating. And finally, I would like to say, as things open up, I would again encourage you to be very cautious. Just because you can do something doesn't mean you should or you have to. And especially if you're over age 65 or if you have underlying health conditions, we really want you to remain vigilant about this virus.
Well said. Thank you, Director Petteway. We are all in together, and only by working together can we protect everyone in our county. Thank you, Dr. Cabanas and Director Petteway, for joining us today and sharing your thoughts and expertise. Thank you also to Commissioners West and Hutchinson for your leadership in this area. I know all of you and your teams will be working tirelessly to continue to protect the people of Wake County as we work through this period. Thanks again.